My name is Tom Miller. I'm the Executive Director of the Blinded Veterans Association, headquartered here in Washington, D.C., and I've lived here in D.C. for the last 24 years, and originally from Detroit, Michigan, however.
Oh, great. Well, thank you so much for your partnership and your service.
Thank you. We appreciate this very much, and the opportunity for veterans to come out and get their health screenings is really critical, and I'm sure people are wondering why Blinded Veterans Association would be involved, and so many of our World War II, Korean, and even those of us from Vietnam now are losing vision, age-related conditions, and so diet and good health is really critical. There are so many conditions which can result in severe visual impairment and blindness, like diabetes and glaucoma and cataract, and our organization has been very much involved in assisting America's visually impaired and blind veterans for the last almost 65 years now. It'll be 65 years in March. And originally we were a war-blinded organization, and all of our members that founded the organization were blinded in combat in World War II in the European theater for the most part. And over the years, many of our veterans now are losing vision to age-related conditions, so our good portion of our membership consists of those vets who served honorably in the military, many of them in combat situations and with service-connected disabilities for things other than blindness, but later in life have lost vision associated with aging, as I indicated. So good health practices, diet, and all the things that are being screened for here today are critical, not only to their physical but also their visual health and well-being.
Can you talk about the importance of today's event? You look at the partnership today. You have 13 veteran service organizations, the Redskins, GlaxoSmithKline. I'm with Men's Health Network, and we have other health partners here today. Can you talk about the importance of that partnership to reach out to you all as veterans and the community?
Well, I think it's absolutely critical. I think the VA reports somewhere in the neighborhood of 24 million veterans that are living today across the country, and while the Department of Veterans Affairs does an excellent job in terms of providing health care and services and outreach, you never can reach everybody, and the more partners we have involved in that effort to outreach to let veterans know what services are available to them, what eligibility they may have for various benefits that are offered through the VA and other federal departments and agencies. It's just critical. There's all the veteran service organizations. We have our own constituencies, and probably in the neighborhood of 15 million veterans maybe are involved with veteran service organizations. So that's another vehicle for reaching out to our veteran population and their families to educate them about the programs and services that are there and available to them. I think so many of our veterans don't realize they have eligibility for service through VA, and it's just critical that they become knowledgeable about and have access to those services for their health and well-being, and for their family members too as well, to know that the VA is there and they have just a very wide array of benefits and services that can be critical for the well-being of not only the veteran but their family as well.
And that's one thing I wanted to talk to you about. I know you had mentioned about the value of diet and exercise and prevention and early detection. Can you also talk about the importance of families when it comes to veterans and their health?
Oh, I think it's absolutely critical. The family needs to be involved. I know when I was blinded in Vietnam almost 42 years ago, and for those veterans that are disabled or otherwise have illness and disease, the family support is just so critical to recovery, to adjustment, and to moving forward and becoming fully reintegrated into their families and to their communities, and to lead meaningful and productive lives. So can't have too many people involved. The pharmaceutical companies, organizations like the Redskins, and other professional sports franchises and teams that are getting involved in trying to support our troops currently deployed around the world, and for those who have come back with severe injuries and disabilities. It's difficult enough to get over some of those kind of things, and the more support one has the greater the opportunity to regain their independence and be full participant in their families and communities.
Right. And my last question for you today was around really, the feeling that you're getting from today's event. We're here in the players' locker room. Do you get a sense of what the veterans are experiencing today? Do you sense that they're enjoying it? It seems like there's been a great turnout today. You want to talk a little bit about kind of what you've been sensing about the event today?
Oh yeah, I think there's a lot of excitement. Folks really seem to be enjoying themselves, taking advantage of all the screening opportunities are available, but also the comradeship that exists between veterans who've served, regardless of what era, whether it's World War II, Korea, Vietnam, Gulf War, or the current conflicts. That comradeship is really very, very special, and I think what is key to holding all the veteran service organizations together, the opportunity to get together, share, and to support and encourage one another, and for their families as well. It's a great opportunity to be here at FedEx Field and in the Redskins locker room, and to have individuals like Joe Theismann show up in support of this event and share his experiences. And it's just a very unique opportunity, and I think one that everyone's thoroughly enjoying and benefiting from.
That's great. Well, we can't thank you enough for coming today, and thank you for your service.
Okay, well, thank you.